The budget debate continues. The healthcare union unsure when herd immunity can be obtained, and police investigate an alleged armed robbery and rape. Good evening, everyone. I'm Leah Cooper with your JCN News for this Thursday, June 17th. Debate in the House of Assembly continued today, with Health Minister Renward Wells taking the floor to continue his contribution to the 2021-2022 fiscal year plan dubbed Accelerating Recovery from Restoration to Growth. The minister noting that his ministry looks forward to participating in the rollout of that plan, noting that the healthcare improvements and vaccinations form the third pillar. The minister provided full details of money allocated for his ministry for the upcoming fiscal year. Overall, the Ministry of Health will receive $297,081,014, $45 million for the National Health Insurance Authority, and some $47 million for the Department of Public Health. A little more than $223 million has been allocated to the Public Hospitals Authority, with substantial investments in public health infrastructure, as Minister Wells contends that the focus is on saving lives, improving health outcomes, and putting much more care in the word healthcare. That said, Princess Margaret Hospital and the Rand Memorial Hospital on tap to receive new facilities.
Under the ambit of the Public Hospital Authority, I am pleased to present to you that during this budget period, we will undertake the construction of a new 6-story tower at the Princess Margaret Hospital. The new construction will be a 96,288 square feet, multi-storied medical, surgical, and maternal and child health tower near the present critical care block. Mr. Speaker, this tower will enhance the service delivery model, increase the service capacity, and expand the scope of services provided with limited disruption to service delivery. The tower will also provide easy access and flow of patients on the inpatient wards that accommodate the primary users of the intensive care, neonatal intensive care units, and operating theaters.
As for the Rand Memorial Hospital on Grand Bahama, Minister Wells says that facility will receive a 4-story tower, both towers at PMH and the Rand, to be completed in 24 months. The minister adds that the PHA is getting some $89 million for renovations to public health care facilities.
Mr. Speaker, this year and next year at the Princess Margaret Hospital, renovations will take place in the following locations: the I Ward, Female Medical 2, the former Physiotherapy Unit, the former Female Surgical 2, Children's Ward, Male Medical 2, and the Decommissioned Intensive Care Unit. Mr. Speaker, at PMH, we will complete the Phase 2 of the Urgent and Emergency Care Project. I am pleased to advise the general public that construction on the enhanced emergency department facilities initiated as part of the Urgent and Emergency Care Project is near completion.
First phase renovations at PMH started in November of 2019. The minister says those works are expected to be completed early in this upcoming fiscal year. Second phase expected to begin in July this year. Minister Wells says funds have also been earmarked for continued renovations at the Rand Memorial and the Sandilands Rehabilitation Center. Meantime, during his brief presentation to the budget debate on Wednesday, the health minister revealed that by the end of the upcoming fiscal year, the country will have approximately 170 Bahamian nurses for the healthcare system. The minister, addressing the nursing shortage that has plagued the Bahamas for some time, says that the University of the Bahamas recently graduated 40 nurses with a Bachelor of Science degree in nursing, adding that these nurses are set to sit their nursing council exams in November this year. Another 30, according to the minister, will graduate by the end of this summer session. Minister Wells told parliamentarian colleagues and Bahamians at large that next year approximately 100 nurses will follow this same path. Just last Wednesday, former Health Minister Dr. Jcn said the shortage of nurses in the country is one of the greatest threats to national security, adding that the country is losing nurses in droves. Minister Wells yesterday said the Ministry of Health is creating the tertiary institution, the full suite of allied health professionals that will produce experts for subsequent years to come to fully staff the country's healthcare system. And as the country has recorded more than 12,000 cases of COVID-19, Consultant Physician Staff Association President Dr. Sabrika Butler-Pinder says it's too early to predict if the country would be back to pre-COVID-19 conditions by at least December this year. She shares this much with Jcn's news team this morning.
I think we have seen before that even though we see that there appears to be a decrease perhaps in numbers, we're not quite certain if that is a true picture of what's happening in country or not, because I think we're still not having people get tested.
Based on health officials' latest figures, 102,786 tests have been completed to date, and more than 60,000 doses of the vaccine were administered. Asked what she thinks is a comfortable number to declare herd immunity, the CPSA president says this.
Experts that are specialized just in that area are still looking at what would be a good percentage to say of persons in country for herd immunity to happen. And I think the last I recall that it was very high, around 90% or so. And so I think if you look at our numbers, I don't think we're at 10%. I don't know if we're at 5%. We have to look at whether it's 10% of 400,000. I don't think that we have persons who decrease that. And so to go to 90%, we would definitely have a long way.
Based on what she has observed in the community, she adds that there's much more work to be done to fight this deadly virus. You're watching Jcn News. Stay with us.